Hi, this is Dr. Kate Eckert, and today's episode is on when you should use shockwave therapy or laser therapy as opposed to other pain management therapies like medications, steroid injections, epidurals, ablations, those kind of things. Now, if I were giving this advice to a family member, I would suggest trying the least invasive option first. For me, that is hands down shockwave therapy and laser therapy. If somebody comes in with an acute issue, so not something that is very chronic that they've had for 20 years, but something that is just flared up and we don't even want to do muscle work on them, we don't want to adjust them because they cannot lay flat on the table, those kind of patients. Laser therapy and shockwave therapy is perfect for them because it gives us something that we can do proactively that they can tolerate instead of trying to get them into a terribly uncomfortable position to get adjusted when they're going to be guarding and resist it and possibly make them worse depending on what exactly is going on. So if somebody comes in with something super flared up and acute, we have it set up in our software system as a special acute flare-up visit that they get both shockwave and laser therapy. Now, the trouble with that is typically when somebody is in an acute flare-up, they have probably taken an NSAID. So the NSAID will make them not a candidate to do shockwave therapy, but they could still do laser, try to help reduce some of that inflammation so that they can stop taking the NSAIDs, possibly switch to just Tylenol, and then we introduce the shockwave therapy when they can tolerate it. Once they get it under control so that they can lie flat on our table, then we introduce the muscle work, the standard adjusting, those kind of things. Now, every case is different, case by case, but when somebody is super flared up, like I said, my first go-to is shockwave and laser therapy because we can tailor it to what they can tolerate. And we've really seen good results with it. We love laser so much for those super acute things that we've even invested in 4 portable lasers. So now they are only class 2, I believe. The laser that we have in the office is class 4. It's obviously way, way more expensive and we have to administer it. But these little portable lasers, patients can take home, they can use multiple times a day, and it helps to get them over that hump where they can get traditional treatment and get off the NSAIDs to then use the works really well for those acute issues that you would typically go to your PCP and get a prednisone pack for. Now, I think that's a great alternative to the prednisone pack. I don't see a ton of harmful side effects from a prednisone pack because they're short-lived, I think, but they don't always work. Often they don't work, and we see those in our office because if it's not working for you, then you can come to see us. For our more chronic, long pain patients that have had their issues for decades, they're going to their PCP for a different issue. So it's more chronic. Maybe they've been put on meloxicam or longer NSAID that they're taking all the time. They might be referred out for injections. Now, there are side effects to steroid injections, and usually patients that I see get multiple steroid injections, and there are risks with that. So I think it is a no-brainer that you would try shockwave and laser therapy before you would take on the risk of doing a course of steroid injections. You can just look up on the Mayo Clinic website and see what some of those risks are from prolonged steroid injections. There are things like joint infection, damaging your cartilage, thinning it out. It compromises your tendons and ligaments, leading them to possibly rupture. I have had that happen to patients. Cause osteoporosis of the bone where the injection site is, and that osteoporosis means it weakens your bone. So it can potentially lead to things that will require you to need surgery. And it's not something that happens like instantly. So it's hard to pinpoint that that is what caused it. Like, you might not rupture your Achilles tendon right after you have the injection. It might happen after 3 injections and not until a year later, because it's weakened it over time and the event doesn't happen until it's pretty separated from what you were doing. But it's just something to keep in mind. Now, does this happen to everyone? No, but it is a risk. It is something you need to think about. And it's something that is not a risk with the therapies that we use, and we do see phenomenal results with the therapies that we use for a lot of the same issues that they use steroid injections for. We treat all the different joints in the body. One of the main things that they use shockwave therapy for is plantar fasciitis, and that is pain in the bottom of your foot, often at the heel, and that is a notoriously painful spot to have a steroid injection at. So much so that one of the local orthos has sent us patients that he thought would think that the shot was super painful, and he says, go see her before we try this. It's not going to be pleasant. And I really appreciate that, because not only is that shot super unpleasant, we can really help people with plantar fasciitis. Now, is it going to work as quickly as a steroid injection? Heck no. Steroid injections are meant to work quickly. They mask over what's going on, and then typically the relief time is shorter. We are the exact opposite of that. Shockwave therapy breaks up the calcification, it increases blood flow, and it stimulates cell regeneration. So the first two things, the breakdown of calcification and increased blood flow, happen relatively quickly. So if you're going to see results right away, usually that's what we're experiencing. The cell regeneration takes 2 to 3 months after each visit. So it is a long game. It is a way more comprehensive fix, and it's regenerating the tissue. It is starting you brand new. It is amazing, long-lasting fix, but it takes time. You have to be patient, and when you're in the middle of it, it seems very slow to you sometimes. Some people respond in one visit, or are one-hit wonders, or earlier. We love that for them, but we do tell them, please don't tell people that, because every case is different, and we try to give you the worst case scenario, because we love it when you are pleasantly surprised and feel better in 1 to 2 visits. That's great. But for some people, it takes a long time. It takes to the 6th visit till you start to feel, oh, I'm feeling better for a day or 2, and then it comes back. That is magic. That it tells us we're doing what we need to do, and it is working. If at that 6th visit, the 6th week, we start to see a little bit of improvement, that means it's working. The cell regeneration is coming. You just need a little more. If you've had those issues for a very long time, it might just take time to get that cell turnover, get that regeneration to happen. Do not get discouraged. And it feels like such a waste if we get somebody to that 6th week and they feel a little bit of relief finally, but they're not good visit to visit, that then they stop, because we really want to get them feeling good from visit to visit. And that tells us we're in the clear. They're probably going to be really good for at least a year or more, depending on what they're doing in their day-to-day life that's causing something to create that issue, if it's their job habits or that kind of. This is so much different than steroid injections, but it does give you really amazing risk-free results. So if it were apples to apples, this is a no-brainer. You would obviously pick this first over medication or steroid injections or epidurals, but there is the issue that our stuff is unfortunately weirdly not covered by insurance. So there is that money factor that people want to try the free thing that does come with risks before they try our stuff. And I totally get that. I understand that. We are trying to make it more accessible to people, and having one free treatment day a month to make it available to everybody. To recap off that episode, we definitely recommend trying our therapies before trying medication or steroid injections, just because of the reduced risk, and we get such good results with similar issues. That is working in the vacuum where, you know, money is not a concern, and we do realize that there are cases where that is a stumbling block. So we do try to make it more accessible with people. We do one free treatment day a month, and we also offer payment plans for our therapies, and we do hope that they're eventually covered because they are that successful. So if you have any questions, I would love to answer those for you. Feel free to reach out.